Good day. My name is Andrea Finney, and I'm a first-time PowerPoint presenter. Although we had a type of family-administrated health care as early as the first settlement at Jamestown, Virginia, we did not have a collective understanding of health care until much further down in history. We start with the 1900s in the U.S., where we see the American Medical Association, a direct result of the Marine Hospital Statutes. The standards developed with this new association established the policies for years to come. The financial status at this point remained fee-for-services and therefore not uniformed within the nation. Legal situations did not show up as an issue until further in our nation's history, when we had a system of a national standard. Healthcare workers were mainly the doctor and a family member as the nurse. Our advancements in medicating from penicillin to today's mutated viruses used in cancer treatments has driven our nation's healthcare from a barely acknowledged one to a high-powered industrialization conglomerate. The financial possibilities for medicine started its rise here with the capitalism of the field to the capping of the medication advances. Legally, our nation mourned during the Depression for what could have been to what will happen next. FDR started our nation on the first step to socialized medicine. Healthcare workers were continuing to advance with the physicians and nurses being standardized tests as a whole, yet out-of-reach areas of the nation remained with substandard care. Our social awareness of everything from our nation's foreign war policies to our national healthcare issues was up for grabs. We found our vets and our elderly, pediatric and unemployed population growing without healthcare. LBJ signed our first Medicare and Medicaid health care bills into law on July 30, 1965. The nation was justified in their protests, yet short-sighted in their dreams. Medicare was to be a finance option associated with the nation's Social Security Act. This did not uphold to the solid foundation. The legal steps to give these programs substance are unresolved, even now. The healthcare professionals have become more specialized through need of the clients. The needs of the public health for prevention of illness has become a go-to platform in the political arena. Therefore, we see more PT and OT and other therapies arising. Reagan economics gave us a new way for reimbursement for our healthcare issues. Diagnosis-related groups, DRGs, became the way to charge for healthcare needs. We see one payment for one ailment reimbursed to everyone the same way, no matter if the ailment is the same or different for the individual with that crisis. Financially, we see many doctors not being paid or paid too little or even too much for a DRG. The result is many legal battles being fought when malpractice issues arise with those DRGs. The social arenas are still brewing with discontent over no care for all the masses. Healthcare professionals continue to divide into specializations, and a new healthcare professional arises in the billing and coding, MOAs. Without the office help to establish the payment, billing, and coding now needed to be paid, healthcare is on the ropes. Seems like a space odyssey instrumental should be playing softly behind this entry. However, this is where we see the Patient Protection Affordable Care Act. Obamacare, or the ACA, has our nation coming full circle. This act promises affordable health care for all citizens. From a financial standpoint, our money is pulled into our Social Security and retirement funds, and if not done this way, then done by penalizing our income tax refunds. Legally, the ACA has no power to offer affordable health care to anyone at this time. ACA sounds good but falls short of accomplishing its goals at this time. Healthcare professionals continue to fragment into more specialized fields, furthering a confusing array of options that confuses the client. The office clerks of the next generation healthcare workers that will have a position in the future. Medicine continues to grow. Patients will always be abundant, and the U.S. healthcare system will continue to be a headache.
The U.S. having no uniform or universal health care coverage means simply that our costs are greater than other countries. Insurance companies charge what they please, as do doctors and hospitals for services rendered. Our advancements in flourishing science to incorporate new technology and drugs for the medical field is an ongoing and rising cost, adding to our $2.9 billion medical industry. With chronic diseases such as obesity and heart problems and cancer, we keep doctors and pharmaceutical companies busy. Administrative costs in the U.S. are higher than any other countries because everything can fall under this nebulous title. This graph shows the per capita spending for the U.S. and other countries for 2012. The numbers have only gotten larger in the past few years and are expected to rise even higher over time.
The National Healthcare Services of the United Kingdom was established in 1748 with the Royal London Hospital on Whitechapel Road in London, England. The London NHS Trust brought this to the legal resident masses in 1948, free with taxation. The United States is in its infancy with a national health care system. The U.S. is striving for stability and flexibility of care. The center of our ambitions is the Patient's Bill of Rights of 1998. We see our care from preventative to emergency care roughing out into an ACA-based care. Comparing the London NHS Trust to ACA, we find that the survival rate of most critical care higher in the U.S. than in the UK. The U.S. has advanced care and, with the use of alternative care, a better system in treating patients. With that being said, we also find the higher cost via private pay and insurance in the U.S. versus the UK. Pros and cons have been debated for years over who wins the gold star in nationalized healthcare systems. For instance, we see equal care to all, the legal resident British, yet greater quality in the care of the U.S. populace. The opposite can be said with less universal care of the U.S. populace as a whole. As well as in the UK, they have next to no preventative care at all. These two healthcare systems are created with similar healthcare structures. The hierarchy the healthcare professionals are based on and the same principles. The coverage costs for both healthcare systems are supposedly funded equally by taxation. The differences remain with lack of positive progress in the UK versus the US, and the level of standards remain subpar in the UK compared to the US.
Healthcare has grown and changed over the years, so it resembles a Frankenstein monster of sewn together bits of laws and ideas. In the end, it resembles nothing but a large band-aid covering a gaping wound. We will look at where healthcare is going now that we know where it has been. Reforms of the ACA or Obamacare will progress where we will see the decision governmentally controlled. The EHR/cloud is taking in all of the area healthcare needs and making it easier to control the client's data. Large hospitals will be utilized less and less with retail clinics and insurance-owned hospitals. WebMD has become the go-to place for many people looking for free medical aid. The purposed payment into a fund for ACA, especially new laws and taxed pharmaceutical and medical devices, will have citizens in the U.S. up in arms because this did not make ACA a way for all to have care. Healthcare, in whatever trend, view, or progression, will continue to evolve. We will see increases in the needs to the public's increases in cost. No matter if the U.S. climbs in the national insurance bandwagon or falls off one, the transitions to come will be slow in coming and heavy in debt. We have seen many reforms come and go, most based on the same template with strategic ideas thrown in to entice the public to sign on. Albert Einstein said, "Insanity, doing the same thing over and over again and expecting different results," which sums up healthcare reform beautifully. Much like cell phones for a prop in science fiction television shows, or the many devices we read about in sci-fi novels, technology is reaching forward and bringing us innovative and intriguing tools we use every day. These tools are used in medicine today, the MRI, robots that help physicians with surgeries, and etc. Technology helps improve the medical community. Healthcare reform is slow simply because no one has a workable idea on how it should work. An army moves on its stomach, healthcare reform moves with money. It is treated like a business when it is a sinking ship, an albatross around the nation's neck. This business is in the red, in the weeds, and out to lunch. Healthcare reform will never work as long as the profit margin is the finish line.